Preparing to live stream, it says. Okay, I think we're live. Hey everybody, this is Leslie Lockhart with Friendship Living, formerly Abington Life. It's been a long time since I've done one of these. People have just been crazy busy, but I'm happy to do another Real Talk interview today with Amy Pannullo with Peak Pelvic Health Physical Therapy here in Apex. So, hello, Amy. We just to tease a little giveaway at the end of this, she's going to have a giveaway to explain to us. So Amy is one of my wonderful sponsors of the new Friendship Living, also on my Women in Networking group. And she is a physical therapist, but there's much more to that. So Amy, tell us about you, your business, your role in the business, and just a brief overview of what that does.
Sure. Thank you very much for having me, Leslie. I'm really excited to do this today. My business is pelvic health physical therapy, named Peak Pelvic Health because everybody wants to be in peak health, but peak pelvic health is such a huge part of that. When we think about some of the number 1, 2, 3, and 4 reasons why people end up in nursing homes when they get older is if their pelvic health isn't good, they can have issues that land them in places that they don't necessarily want to be because they can't care for themselves appropriately. So my business started originally in 2019. So just before the pandemic, I started working for myself part-time. And then in 2020, I started for myself full-time. And then obviously pandemic became full swing. And it changed things a little bit for me, but I am the founder, owner, and only physical therapist here with Peak Pelvic Health Physical Therapy.
Awesome. And I am a client. And I know she can't disclose that, but I can. And I go to her to have some of my parts fixed, working on some exercises and things. So hopefully I will beat the odds and not be one of those people who has problems when I'm older, combating them now, especially after having a baby and all the things that, we go through as humans. So tell us more about yourself and your family.
Sure. So I am married with 2 children. I have a son, Zachary, who's 12, and a daughter, Caitlin, who's 10. And they are both just wonderful kids, doing great in school. They're so thankful to be back in school in person this year. And they both play soccer right now, and they're loving that. We also have a dog named Harley who loves to be out there with us all the time. So very outdoorsy family. We love to be, out and about as much as we can be, but we're also a big sports family. So we like to sit down and watch some football together too on the back deck. But my husband and I moved here in 2006 from Long Island, and both of my children were born here. Although if you ask my son, he'll tell everyone he's from New York, but they were both born right here, Wakenet and Cary. And I am an avid runner. So outside of spending time with my family and doing work and helping people, I love to be out there running. And a morning like this morning, 36 degrees and cold.
Oh, yes, it's cold.
That is my favorite running weather, my favorite. Oh. So yeah, I really enjoy being out there running.
You like to see your breath.
I do. And I don't like to sweat, right? Like I don't enjoy sweating. So if I can be out there and run and then just go about my day, that's an awesome thing. But I do shower before work.
Good. And you want all your clients to shower before work too, or before you come in. So tell us more about your business. Like, you didn't just start this physical therapy thing just a couple of years ago. You were doing it way before that, right?
Oh, correct. Yeah. So for myself a couple of years ago, but yes. So I originally went to school for sports medicine and athletic training, and started working in a physical therapy office and realized that's really what I wanted to do, was being able to bring it, more across the spectrum and not just working with high school and college level athletes. I had no idea that pelvic health was even a thing. So when I went back to PT school, I went back to school in 2001. It was amazing to me to find out that pelvic health was something that existed, just absolutely incredible. And at the time, it was just women's health. So to learn that there was something you could do to help women with issues that I'd never heard anyone talk about before, and it wasn't surgery or medication related alone, and the cure wasn't just surgery or medication, really got me excited. So I specialized in that quickly once I graduated. we moved down here to North Carolina, and I worked, got a job right away with the Duke Health System, and was trained up very quickly as a pelvic health physical therapist. And I was with them for 13 years, and truly I learned a ton. I worked with an incredible team there, got to mentor residents while I was there, and I loved it all. But I really just got to the point that I needed a little bit more of a work-life balance to be able to kind of help with my children the way I needed to, as they were getting older. And it really was lucky for me that I made the move when I did, because no one foresaw this pandemic coming along. And I was able to be home in the capacity I needed to be for them as well.
Right. So it's not just women though you can help, right? Everybody has a pelvic floor.
Everybody has a pelvic floor. Yes. So I treat women, men, and children. I have seen patients as young as 5. And I think my oldest patient is 86 years old. So it's definitely across the lifespan. I just had a patient ask me today, kind of like, where's your normal range for patients? And I think typically it is kind of 30s to 50s. And I truly believe that's because when people start kind of taking their self-care more seriously and maybe finding time for that, and just recognizing their life or their body starting to change a little bit more. So I do see all ages, and like I said, male and female as well, across the lifespan. Yeah.
And just so everybody knows, I'm one of those open book people. I'm authentic. Sometimes I share too much information, and it's about to be one of those times. So 3, 2, 1. I've been seeing Amy for a couple months now, seen her 4 or 5 times. And I noticed today, Amy, you'll be excited. I did not leak at all. Anyway.
I'm so excited. I'm so excited. So
yeah, I mean, after having a baby and stuff, people just think that's what's supposed to happen. And it's just getting older or whatever. No, anyway, go to Amy.
No,
So
common but not normal, right? And so you're
yeah.
doing the work to get better, and I love that. You're motivated to do it. So you are doing your part, and then you let me do mine. So that's really great.
Yeah, awesome. So how has the pandemic changed your industry and your business? But your industry, like what precautions do you have to take? Both voluntary and mandatory. What's different?
So I think the biggest change was kind of right away, just us not knowing what to expect, right? Or how things were being transmitted or what was happening. So initially, I was in a position where I could close my business down, because the kids were no longer in school and everything was virtual. So I was able to shut down for a couple of months and really be home. And then coming back, just really trying to follow as much as we could CDC guidelines and trying to maintain just familiarity with how those were changing. So things like longer time in between patient appointments, cleaning more things than I used to clean. So wiping down every single door handle, just really not just like the plinth and, supplies, but now I'm going to wipe down my computer every time. I'm, just kind of going above and beyond in that aspect, just to really try to keep things as safe as possible. Wearing a mask, that's been a huge one, right? I didn't realize how much I relied on people's facial expressions. And I guess reading lips, I do a lot. That's where I kind of connect with people. So that's been a big change. But then also, I think it's allowed me to slow down because I came out of a university hospital setting where things were very fast paced. And even though we had longer appointment times, you just kept moving, right? Where you saw every patient every hour on the hour. And now I built into my schedule some leeway where I have a nice cushion to make sure I have time to get the room ready and ideally do some charting, but it's just a slower pace. And what I find is I'm able to take even more time with patients than I intended, which has been really nice. And I think, just trying to be more aware of what patients need and, whether or not they're having immunocompromise and trying to work with them as best I can. I know one big shift in the industry for us was telehealth, right? And I know that's for a lot of providers. I will say, especially when I was closed, I did have patients reach out and ask if they could do a telehealth appointment with me. Leslie, I mean, you've seen me, so like what I do is largely hands-on, right? Not even where I'm doing it, but I'm largely hands-on when you're in clinic with me. So I just didn't feel
Well, you
that.
have to feel muscles and stuff. Like you can't.
Yeah, and I just didn't feel like that was something I could offer. So I'm happy to like talk to my patients over the phone or do Zoom and just answer questions and spend that time. but not in a way I'm going to bill you for it, because I just don't feel like that's, even though some would argue that we're educating and we're doing, it's not the way that I would typically choose to do that. So I just feel like telehealth isn't for me, but I can definitely still have the conversations, I don't mind that at all. Yeah.
Well, before we get to the giveaway and wrapping things up, so I was going to ask you about other small businesses that you love, and I know you do a lot of networking and know a lot of small businesses, but and you're part of the chamber and everything, but like tell us about your partner over there, that it's a separate business but you share a space. So who's that?
Yeah, so Jessie Mathers, and she's with Evolution Physical Therapy and Wellness, and she is certified in dry needling. She's a manual therapy fellow, wonderful. So I always think of her of like, I kind of live, rib cage to mid thighs type of thing, and she lives everywhere else. I mean, she also covers back, all the other good things, hips, but she does all of everything else. She's also a mindfulness, I believe it's a mindfulness coach. She has a certification in that as well. So she is a wonderful resource for people, and just a wealth of knowledge, does some teaching as well for Elon.
And I know Jessie too. We haven't signed her up yet as a sponsor, but working on her. She just won one of the like best of Raleigh awards too, which is great. And where are y'all located?
We are in Apex Professional Park. It is just across from Beaver Commons, 1071 Pemberton Hill Road in Apex.
Yeah, awesome. So tell us about the giveaway. What are you giving away?
So I have this fabulous little bag here, little travel bag, and inside of it, I have TheraBands. And these are great because they are actually connected from end to end. I'm going to open one up so you can see it. And they are a great thing that you can use. You can take it when you travel, or, just throw it in your purse, or just have it at home. But it's a great way to do exercises. Look, I'm ripping it open here. Or now you can add some resistance to it, maybe.
Oh, okay.
Leslie. Right? So you
But
can
not just for physical therapy, but exercise in general.
Exercise in general. So it's resistance band training, and resistance bands have really come a long way, and there's a lot you can do. You can use this, on your ankles, around your knees, around your arms, and it's just a great way, instead of having to have weights at all times, using some TheraBands. So I have this particular package has 5 different resistance bands in it, from light to heavy. Yeah.
Awesome. Well, thank you. So how do you enter that giveaway, people? You watch this video that you've been hopefully watching, and then you like the video, you tag someone you think might be interested in seeing the video and learning about Amy services. You share it, comment, however you engage, you'll get an entry, and I'll draw a winner after we have a little bit of engagement in a week or two, and then put you in touch with Amy to get your prize. But I'll be tagging Peak Pelvic Health Physical Therapy in the comments, and so you can check out her page, like it. And anything else you want to share?
I just think, a lot of people still don't know what pelvic health physical therapy is all about. And just thinking, if you have urinary incontinence, if you have pelvic pain with intercourse, tailbone pain, muscle separation from pregnancy, anything like that, reach out to a pelvic health physical therapist, because really there's so much that can be done for you.
Awesome. Sounds great. All right.
Thank you so much, Leslie.
Yeah, I'm going to figure out how do I stop going live. Stop live stream.